Hi, good morning or good afternoon to all of you. My name is Ofer Harpak. I'm the CEO of Oxitone in Israel, and I'll talk about continuous data plus AI, which all agree that this is the future, and I will try to show you that the future is here. No need to wait. So basically, my background is computer engineering. This is my fourth company. I'm what the people call serial entrepreneur. First company merged with another company and went to IPO in London. Second sold to Siemens in Germany, and the third one sold to Deutsche Telekom. And this is my fourth company. And I'm always proud to say that my investor made money. So here we go. So we all know that population is aging all over the world. People live longer thanks for the healthcare system and the improvement in the medical care. And as a result of it, people live with chronic disease or multiple chronic disease for a long time. People with chronic disease have to live with the disease. There is no way to cure it, and they have to live with it few years at least, or as more as possible, of course. The solution for them is not hospitals. They shouldn't stay in hospital, and as you can see from the numbers, basically more than 50% of adults in the US, for example, suffer from more than one disease. 12% of them will suffer from 5 chronic disease, consume 41% of the healthcare budget. So we all know that this is not scalable and it should change. So the question is how to change it. So if we look on the current solution for telehealth for remote patient monitoring, name change, but it's the same industry, they don't meet the needs. And many of the reason it's spot check, you measure once a day or twice a day, you don't know what's happening in between. You need many devices and a lot of patient action, which is not done by the patient. And there is no really analytic or a multiple parameter measurement. It's one parameter per device. So people is not complying to this service. And I always give an example from different industry, which is very clear. Are you ready to buy a car without a dashboard? Let's assume that you have a speedometer. Every 10,000 kilometers, you have to get into the garage for maintenance, or if you see smoke coming from the engine. And we all know that this is not acceptable by any customer. Even the low-cost car or the cheapest car have a lot of real-time indication. You see the oil, the temperature, air pressure in the tires, and many other parameters in real time. And if the temperature is too high, you will stop immediately and check water. You will not wait till you will see a smoke coming from the engine or to the next maintenance. But when it's come to our body, we are acting very differently. There is no real-time data, no real-time action. You visit your physician every few months, 3 months, 6 months, once a year, depending on your anxiety level. And it may be too late. And doctor miss a lot of events, and people can die in between. If you look on example of the set of piece of equipment that you need in order to monitor from home, you see that you need a lot of equipment, Again, you need the patient have to do something in order to start testing. You're doing it once a day or twice a day, or when you feel bad, which might be too late. Uh, and it's only relevant during daytime. Nobody knows what's happened with the patient during night. When he's sleeping, he's not doing any measurement, and many of the cases is people die during night. So what we can say is that the need is basically mainly for high-risk patient is a prompt response. When emergency happened, deal with it immediately when you see it, when it starts, and not after it's already affected. And for physicians, they need easy and timely way to follow up patient. Right now, they don't have it. So the feedback have to be close with action items. So here we come. Basically, what we have done, we developed something that looked like a watch, but this is a halter on the wrist, uh, and it's come out with a full turnkey solution that enables the patient to be monitored 24/7 without any intervention. So what we are doing basically, we are asking the patient to wear this device. The device is not a gadget, it's not a consumer device, it's a medical device with FDA and CE approval. So it's reliable and accurate, and it's taking measurement continuous and automatically. And we are taking a full set of parameters. The most important are oxygen blood saturation, SpO2, pulse rate, which together with pulse oximeter. It's replaced the fingertip type of device that we all know now after the COVID that are taking measurement once a day or twice a day. We also measure heart rate variation that indicates stress level, activity, step, and motion. We analyze sleep pattern and sleep efficiency. I will elaborate on it. We are measuring respiratory rate, skin temperature, and very soon we will add blood pressure and cardiac output. It's in the pipeline, and fall detection immediately after. So now basically the device is taking a lot of measurement of different vital signs. We are taking it every 1 second without any patient intervention. So once the patient is wearing our device, he doesn't have to do anything. And once every second, we are taking full set of measurement and we upload everything to the cloud. So now we have a lot of data, real time, with a very high resolution. So we supply a full solution, starting on the left side from the device on the wrist, going into the cloud with reporting and analytic tools, with report and messages to the physician or for the care team, nursing home, and nurse stand, or any other uh, control panels that will look on the patient. It might be a telemedicine service, RPM, and somebody will get a message once needed. So basically, we are using a cloud with a AI system that give you a report, analytic, symptom, care plan, dashboard, monitor identification, and it's starting with a patient app on one side and cloud access from the other side for the caregiver or the physicians. And this is just an example of what you can do with data that we are supplying, and this is actually a report that we are generating after a patient night sleep. You are pressing a button and you are getting this report. And the report will tell you automatically when the patient went to sleep, when he wake up, how many times he wake up during night, how many desaturation events he have during night. 3% below average, 4% below average, ODI index, distribution of saturation during night, distribution of heart rate during night. We are showing variation. We show the gradient. If the gradient is positive, stress level is good. If it's negative, the patient is under stress. So basically, we are generating a full data out of our measurement during night, and we allow the physician to see immediately where is the problem, if there is a problem, and what to do with the patient. And the physician just have to add his conclusion, recommendation, and either send this report to the patient or just store it to another tool. So this is an overnight report, and this is again just an example. Typically, people that need it, it's people suffering from sleep disorder. It's this group of people are snoring during night, and in the extreme situation, they can stop breathing during night and even die. Many of them are sleeping with a CPAP that push oxygen, and we can monitor their vital sign during night. We can do many other things with the data. So the first thing is basically to classify the patient, to build a baseline per patient, because every patient is behave differently and in different situation. And the first thing that we need to do is basically to see how this patient behave and to see what is his normal behavior. It might be that this patient average saturation is around 90 or 87, and you need to set alarm only when it go below this number, or the same go for heart rate. So basically, the first thing that we are trying to do is building a baseline per patient and to see when the patient need to be treated. Because if he's around his normal behavior, no need to raise up any flag and to bother all the system with alarm that doesn't mean anything. And then basically we can build a predictive threat. Basically we are seeing all the measurement continuously in 1 second resolution. So the first thing that we can do is we can identify, for example, drop in saturation. We are measuring every second, so we can see that there is a short drop or long drop on saturation. We can detect trends. The saturation start to drop. The saturation is not change very fast. So we can see that something is starting to happen, and that will allow us to set alarm immediately before the patient is going to a severe situation. So this is something that can be done, and we are doing it over the cloud. The next thing that we can do is basically looking at multiple parameters. And since we are looking on the same timeline on multiple parameters, many of them are correlated to each other. So for example, if a patient is very active and heart rate go up, no reason to set alarm unless his pulse rate is going beyond 200 or something. But if the patient doesn't move or very low activity and heart rate go up, saturation go down, he's going to have exacerbation very soon, which will be a severe situation. So once we see this happening, basically we can send a more meaningful message to the physician to do something. And this is different type of alarm, and this alarm will cause a physician or a caregiver to act immediately and to help this patient to avoid severe situation. So we are starting from the device on the wrist, but we are generating reports and messages. First of all, is a prompt response to emergency that will happen very soon. We are doing early detection of deterioration. We see that something's starting to go wrong before patient will feel bad. We are reducing the number of emergency department visits because if the patient is calm, he knows that somebody is monitoring, and he see if something go wrong, he will not appear in the emergency room often. We are reducing the number of hospitalization and hospital number of days in hospital, which of course reduce cost. And the most one of the most important parameters, at least in the US, is readmission reduction. As you know, in the US, if a patient will come back to the hospital, it's less than 30 days after he is admit from the hospital will not get paid and it will get penalty. In other places, it's just a matter of load on the healthcare team. We want to reduce it, and once the patient is under monitoring, less chance that he will get back to the hospital for no reason. So on a clinical trials that we run with a patient, basically, of course, we validate that accuracy is good. 88% of them show very high compliance for 30 days after discharge from hospital. So 88% of the patient is wearing our device after they discharge from the hospital for 30 days. And for sure, you cannot say it on other system. And of course, we offer a better quality of life because people stay home, no need to come to hospital. Hospital visits are annoying, and they don't help chronic disease patient. At the base case, they don't get any infection in the hospital, but hospital cannot really help them. We have all the approval. We have FDA, we have CE, company is ISO certified. We have 30 patents that are already granted around the world, including in China. And basically, it's keep our uniqueness and competitive edge on other people. Our cloud is compliant with GDPR for Europe and for HIPAA in the US. So the system is secure and ready to go. We have quite unique technology. The way that we are measuring oxygen blood saturation is unique. And this is basically something that many people try to do and failed. Our measurement is taking place around the ulnar bone, around this bone. And this is the only place that we found, and we believe it's the only place to measure oxygen blood saturation around the wrist. And the option to measure around the wrist allow basically high compliance because it allows the patient to wear it 24/7 and to us to measure every 1 second and get to conclusion. So it's not just a matter of convenience where we are measuring, it's enable of a service. Who are the people that we are trying to address? So the first group is people suffering from pulmonary disease, COPD. It's a very common disease, more than 400 million people around the world. It's a chronic disease hurting the lungs functionality. It's very common, especially with people that was smoking or living under air pollution. And it's very common all over the world, but especially on China and the Far East. Typically, we can say that in all over the countries, it's the third or the fourth reason of death at home for overall death. So it's a really big issue. The other group of people are cardiovascular or CHF, people suffering from after a heart failure, suffering from liquid in the lungs. So basically a combination of lung functionality and heart functionality is very important. And we will come with blood pressure later this year. Basically, we can serve all people with cardiovascular problem. People with sleep apnea or sleep disorder, again, a large number of people. Many of them are not aware of it or are not in severe condition, but it affects their daily life. And the fact that they need to go to a sleep lab to sleep on different locations and connected to a lot of wires, basically cause them not to test it and to take care of the system. And as we all know, on the last 2 years, COVID-19 has become a very significant problem all over the world. The first element or part of the body that dysfunction is the lungs. So measuring oxygen, blood saturation, pulse rate, respiratory rate is a most important parameter. And not only for COVID-19 patients, but also for long COVID. We see all over the world that people that suffered from COVID-19 and recovered still need to lose their functionality of the lungs and breathing for a while. We are talking about weeks or months of monitoring patient till they are getting back to the normal location, and we will see it more and more because a large part of the population worldwide is affected by COVID-19. So this is a huge market. We can see that as a part of the COVID-19, that not only related to it, the market for remote patient monitoring is booming. Companies that offer remote patient monitoring service, revenue will double from 2018 to 2023. We see people more and more looking for a solution for remote patient monitoring. They want to avoid visiting in the hospital and in physician, so it's become more and more popular. And for the market of remote monitoring device, the number even higher is multiplied by 5 from 2018 to 2026. So it's a good place to be. This is just to show you a result of our FDA test for saturation and pulse rate. It was done in FDA approved labs in Colorado in the US. And basically what they have done, they took healthy volunteer, reduced their oxygen from 100 to 70, and compare our measurement with invasive arterial blood test, CO test. And they took hundreds of points from 70 to 100. And we got to accuracy of plus minus 2% from the golden measurement. FDA required plus minus 3%, so we are better than the requirement. And we can say that we are at least as accurate as any fingertip pulse oximeter. So we didn't compromise on accuracy and reliability, both for SpO2 and pulse rate, by measuring from the wrist. And physician can take our measurement in the way it's taking a fingertip measurement today. It's accurate and reliable, and this is very important. We just lately passed accuracy test for our respiratory rate as well, and the same lab in Clinimark in Colorado. and we are measuring between 4 to 40, and we got accuracy levels that required by FDA. So if I am looking on the market landscape, this is without taking specific to any product, you can see on the left side a lot of product companies are doing a spot check. Fingertip pulse oximeter is very common, and it's a very mature technology, and you can find hundreds of vendors that measuring on the fingertip. Of course, the problem is it once no system, no monitoring capability. There is another segment that are chest patch that usually are taking place after a surgery in the hospital, either in the hospital or once the patient go home for a week. And these patches are basically measuring continuously. They don't measure saturation, they measure heart rate, ECG, but not saturation. They are not so convenient for males. You have to shave to put it, and it's not something that you are doing yourself, but it's a very effective solution. There is two companies that built upper arm solution. It's not so convenient, and basically we are the only ones that offer wrist monitoring. It's unlimited. You can wear it for a month, for a year, for 2 years, and it will keep monitoring. And there was, just to mention, another company named Spryce that never got to the market, and they was acquired by Itamar Medical for a sleep test. So this is just showing product or offering that pass FDA approval. There is another segment that I'm calling it consumer or gadget, but you can use different words. Many of the consumer product company like Apple with Apple Watch, Garmin, Samsung, this came out with a health measurement parameter in their devices. They haven't went to any validation of medical. They don't have FDA. They don't have any certification. They are not intended to use for patients. They are intended to use for healthy people, measuring their baseline. And since they are not there for patients, they didn't build all the systems that getting the data, analyze it, and setting alarm. And this is we put here Apple, but it's right also for Garmin, Samsung, and all the others. Technology-wise, they are taking the measurement on the bottom of the device, which is not a good place to measure saturation, and not like ours that using the Unabo. And there is typically fingertip. I took here Nonin, which is the leading company in the US, but there is many others that pass FDA, but they are not continuous and don't have the system. And there is some people that call themselves a wrist device, but the wrist is only the electronics, but they still have a fingertip device. So they have FDA, but it's not really continuous. So our uniqueness in the market is kept, and we have a real technology edge in the market. Our business model is basically we are charging for the device and monthly or annually fee for the cloud services. If the customer is ready for a long-term commitment, we can do a renting or a licensing, and we can charge also per report. And our customer is mainly remote patient monitoring company, telemedicine, healthcare provider, long-term facility, pharma and CRO, and we are very efficient for this team. If I have to look on the way it's built without getting into too many details, basically a device on the wrist, a gateway to get to the cloud, and on the cloud we have interfaces for a call center or for AI power portal. We supply some services. Our customer can add their services as well. We are very open to interface with any other platform or EMR or EHR system, and we allow our customers to pull out the data and to do additional analytic on the data. We are supplying a full set of items around it. So we have a smartphone application that allows the patient to see his condition, to fill out a questionnaire. So once the physician will look on the cloud, it will see all, not only the measurement, but also questionnaires that was filled out by the patient. He can do a care plan for this patient, and this is coming with the system. And we supply a full access for physician that can see both. For example, this is a typical picture of a physician screen that will see a list of all his patients. You can see hundreds of thousands of patients. And once you click on each of them, you can see the detailed measurement. Once a threshold was defined per this patient, if the patient is crossing the threshold, it will pop up to the top of the list with different color. So when physician or nurse will look on the screen, it will see immediately the patient that need to be monitored or action that needed to be taken. So he doesn't have to look on all the thousands. Of course, we don't expect physician to watch the patient all the time. We are generating alarm or messages for report once needed. We started to sell last year, so we have already some customers that are using our system. This is a few quotes. Ascom is supplying a platform for a healthcare system, the name Digistat. We are the one that generate for data for them. Harpak in Italy is providing virtual clinic or telemedicine services. And Sheba in Israel, it's one of the best hospital worldwide. It's one of the best 10 hospital worldwide. And they basically came out with a plan they call her Hospital at Home. And we are a major part on this program. Basically, what we can see all over the world that hospital service or hospital behavior will be changed. So people will not go for hospital for many days. They will go for hospital only for surgery or something, and they will go home after it with remote patient monitoring capabilities, and they will stay home, which is more convenient and more efficient and cost less. So this approach will appear all over the world, and we are a major part of it. This is just an example of a deployment that we have done in Napoli for COVID. So people basically, once they diagnosed with COVID, they receive our device and sent home. And basically, once they have been under monitoring remotely, and after they once they basically detected as the condition deteriorate, they was asked to go to hospital. This reduced the number of people in hospital dramatically, and basically made it much more efficient. As you know, at the beginning of the pandemic, Italy was under crisis, and we are happy to be part of the help. As you can see, the measurements that we supply are one of the top list, but they also do blood pressure, which we are adding now. So by the end of the process, we will supply the major part of all the parameters. We are a very experienced team. Altogether, the company is quite small. We are 12 people. Leon Eisen is a PhD from Weizmann Institute, which is one of the most honorable place to study in Israel. He's dealing with light and blood for the last 15 or 20 years. For myself, he's acting as a chairman of the board right now. I'm the CEO of the company, and as I mentioned, my background is engineering, studying the Technion in Israel, built few companies, and took one to IPO. Two was sold to Deutsche Telekom and Siemens, and this is my fourth one. Louis Schenkman is our medical director. He's a professor from New York that live in Israel now. He was the head of department in one of the major hospitals in Israel, vice dean of medical school in Tel Aviv, and he's basically helping us from the day we start. Maurice is our CFO and COO, very experienced. We are working together for 20 years, and I'm very proud to have Dr. Raj Singh in our team. Dr. Raj Singh is our lead investor and a very active board member. He is sitting on the board of Johns Hopkins, and he is the one of the most richest people in the US. Basically, he invested in two of my companies before, made money, and keep supporting the company, and very helpful. So what we are till now, we raised $11 million from mainly from Telecom Venture, which head by Raj, and a few other investors, and we started now round B, and we'll be happy to talk to a potential investor. And what I can state that is not an opinion; it's a combination of accurate, continuous data, and AI is the future. And as I show you on the presentation, we have this solution in hand today. So the future is now. And this is a quote that I like to use. If you have data, let's look at it. If you only have opinion, that's going to be mine. So we supply data, an accurate one. So I will be happy to answer any question or to keep dialogue. All my detail is here, and I invite people to communicate with us and to see how we can work together. Thank you very much.